Hello everyone. Welcome to Yashoda Hospital's online segment, the Health Talk session. A healthy diet is an important part of a healthy lifestyle, especially if you're pregnant or planning a pregnancy. Undoubtedly, it is one of the most vital part of this journey, but less spoken about. So let's discuss about pregnancy and nutrition in our session today. I'm Dr. Lakshmi and let's welcome Dr. Jamuna Devi, consultant gynecologist from Yashoda Hospitals, Secunderabad, and K. Sunitha Premalatha, Chief Dietitian from Yashoda Hospitals, Somajiguda. Welcome, ma'am. So, ma'am, to begin with, why do you think nutrition is so important during pregnancy?
Yeah, it's a good question, Lakshmi. I think the pregnant women should start thinking that kitchen is a high apothecary. That means like pharmacy, it is prepared, drugs are made, produced and all that. And the food should become the medicine. That is why nutrition is very, very important during pregnancy.
Lot of women, while they are planning for pregnancy, they read a lot about pregnancy and diet in books. In addition to that, I think it's very important to consult a dietitian while you are planning for pregnancy. If that is not done, at least the early prenatal visit is very, very important. It gives you ample time to get to know about what exactly is a well-balanced diet. It will help you to understand the importance of maintaining optimal body weight, importance of exercise. Also, it will help you to correct certain lifestyle habits. If someone is an alcoholic, why you shouldn't take alcohol during pregnancy, why you shouldn't smoke during pregnancy, and also understand the importance of having a well-balanced diet so that one can have adequate nutrient reserves. And if someone already has a history of diabetes or blood pressure, they can get these under control before entering pregnancy. So it's very important to consult a dietitian so that the nutritional assessment can be done right from the beginning and they can be on the right track.
So, ma'am, talking about nutrition and pregnancy, do you think women should concentrate on nutrition only once she knows that she's pregnant or well before that?
Yeah, I think now a lot of women are empowered and they are professionals and they plan so well about the profession and finances, and they plan pregnancy only once they are confident with their profession and finances. But I feel bad to say that they are not at all conscious about their health. And this is very, very important. Once you plan your pregnancy, like you think that you want to become pregnant only after 1 year, you have a very good 1 year time to plan. As Dr. Sunitha has already told, that if the body reserve with nutrition is well balanced, then your pregnancy also will result a healthy baby and a healthy pregnancy, and you yourself also will have a very healthy system.
Do post your queries on our social media network and we'll get them answered by our expert doctors here. So moving to the next question, we've got Mrs. Priyanka from Hyderabad. She wants to know what is healthy weight gain during pregnancy.
Yeah, I think most of the women worried about the weight gain and all those issues. But I think pregnancy is the only, time in life of the women where weight gain is most welcome and it is desirable. So, but it depends upon your pre-pregnancy weight. What we say is, when you are below 18, your BMI, then you have to gain about 16 to 18 kg, 11 to 18 kgs. And if it is between 19 and 26, then you have to weigh, your increase in weight gain is 11 to 16. And then if your BMI is more than 26 or 28, then your BMI is 29 to more than that, then your weight gain should be restricted, maybe 7 to 10 kgs only. So this is what you have to learn about the weight gain, because now GDM, that is diabetes in pregnancy, is on the rise, and we see lot of women with these issues.
So ma'am, talking about weight gain during pregnancy, do you recommend different diet plans to different women falling under different weight category?
So when they come to us, we calculate the pre-pregnancy BMI, and we tell them that, look, during these 9 months, this is what is your weight gain goal. Usually for a healthy lady, she's expected to gain weight around 11 to 12 kg during those 9 months. When we monitor their weight, when they are referred to us by the doctors, what we tell them is there is a minimal weight gain in the first trimester. Thereafter, from the 4th month, it is 1.5 to 2 kg on an average. If we notice the weight gain is less than 1 kg or more than 3 kgs in a month, then that's a signal where we re-evaluate, and it should be done by the doctor as well as by the dietitian where she's going wrong. If it is in terms of diet, we tend to correct it, and medical aspects are taken care by the doctor. And when we talk about excess weight gain and in relation to diet, we tell them to cut down on those calorie dense foods. You know, we all are dependent on convenience, ultra processed foods, so which are small in size, these packaged foods, but huge in terms of calories. So we also train them to read the nutrition label, understand the portion size, control the food portions, read the calories, and always diet has to be tailor-made. As how you stitch your clothes, it has to be individualized, taking many factors into considerations. So we educate them on those calorie dense foods and portion control, and how best they can make healthy choices and meet up the requirement.
Here I want to add one more thing, Lakshmi, that normally the weight gain is in pregnancy is because of various changes in the body of the women, like, you know, placenta is formed, so it will add weight. Then the fluid in the amniotic fluid also adds, and the uterus grows to a big size, and that also add, and the baby weight. And even the women also has changes in the system, like the blood volume increases, and the other systems also changes, and all this will add to around 11,000 grams. So this is the natural weight what they gain of during pregnancy. So because of this, we always say that weight gain should be more appropriate.
Do post your queries on the topic pregnancy and nutrition, and we'll get them answered shortly. So moving to the next question, we've got Mrs. Sirisha from Bangalore. She wants to know, can obese people lose weight during pregnancy, and is it safe?
Okay, because most of the time in our country, even today, even among the educated lot, still it is unplanned pregnancy, and because of that, these issues have to be tackled during pregnancy. So when the weight is more, they have to consult to the doctor and the dietitian. So both together can help them, because the weight during pregnancy has lot of side effects. I mean, not side effects, but they have effect on the baby and the mother. Most importantly, as we have discussed, diabetes. Then second thing is high blood pressures, then thyroid levels, and difficulty in delivery, so more cesareans, and all these will add when the weight is more. So it is very important to see that how we can bring down.
First thing, we make it very clear to the client that no fad diets should be followed during pregnancy. Pregnancy is not a time to be on a low calorie diet. You need to get all those required nutrients. As Dr. Jamuna elaborated, what are the major developments that takes place in your body, whether it is the breast tissue formation or the amniotic fluid or the placenta is formed, there is blood volume increase, and for all these developments, definitely there is extra nutrition that one needs, and that can come from a well-balanced diet. As we have emphasized earlier as well, preconception dietary counseling is important. What we do during preconception is we do the body measurements, check their pre-pregnancy BMI, give them the weight gain goal. Apart from that, also review certain lab tests Also check their physical signs and symptoms, whether a lady is anemic or any micronutrient deficiencies. And of course, diet recall is important. We take into consideration what she's been eating all through these years and try to correct within what is feasible and realistic. So, pregnancy cravings are very, very common. So, we give them low calorie nutritious alternatives and try to help them so that they will not gain too much of weight during pregnancy.
In the first trimester, actually there is a organ formation of the baby, and this is the most important part of the pregnancy, wherein the mother's health plays a big role, because the mother's health should be at the best and she should not have any deficiencies like folic acid deficiency or iron deficiency or vitamin D or calcium, and her sugar levels should be correct, to the normal, and thyroid, if she has, should be controlled and should be within the normal limits, and these will benefit the formation of the baby. And as we know that folic acid is very important during first trimester of the pregnancy, and it is better taken well before the pregnancy is planned, because the congenital defects are prevented because of folic acid.
Absolutely, ma'am. So talking about fad diets, can a carb-free diet harm an unborn baby?
Absolutely. We don't advise low carb diets during pregnancy because there is a minimum amount of carbohydrates that are required in their diet. We usually tell them that very clearly 150 grams of carbohydrates in a daily diet should always be there. Otherwise, it can lead to dangerous conditions like fetal hypoglycemia and can have adverse effects on the pregnancy outcome as well.
Because when they have a low carb diet, the cortisol is released in the mother's blood, and that will pass to the baby, and that will lead to affect the baby. And later on in the adulthood, once the baby is born, after they are born in adult life or in the middle age, they may develop high blood pressure, and this is very, very important not to have low carb diets.
So moving to the next question, we've got Mrs. Pallavi from Vijayawada. She says that she is 27 years old and this is her first pregnancy and she was diagnosed with diabetes. Is this common, and what diet to be followed?
When a lady is having high blood sugar, when they come to us, we tell them about appropriate weight gain is important, because increased weight gain can put them at high risk for developing gestational diabetes. If they already have and they come with increased blood sugars, we educate them on the different types of carbohydrates. One is the complex carbohydrates, which come from less processed cereals, fresh fruits and vegetables, which are healthy sources. We tell them to avoid or rather limit the simple sugars which come in form of ultra processed packaged foods, and also tell them about glycemic index, where you categorize the food depending upon the ability of the food to increase blood sugar level. So we tell them that you need to cut down on those foods which have high glycemic index. Also tell them about glycemic load, what is the impact of the dietary carbohydrate on blood sugar levels. And definitely we educate them on the portion size, because we don't want too much of food at the time. So timing, quality of the diet, quantity, all these are the aspects that have to be looked into so that her sugar levels are well maintained. Individual with diet alone, or at times there could be some medicine that is being prescribed by the doctor, or at times insulin. So we need to see that the meal timing and medicine are well coordinated so that there wouldn't be any hypoglycemia or hyperglycemia. For example, white bread has high glycemic index, or polished rice has high glycemic index. So these are the more processed foods which are easily digestible, like we have cornflakes which have high glycemic index. Eating a corn on the cob is a healthy option when it comes to glycemic index, but refined foods have more glycemic index.
When you are pregnant and you are diabetic, there are a lot of issues, like baby will have low growth, the weight of the baby may reduce, we call it as IUGR, or you may go in for a preterm labor, and in the early pregnancies there may be abortions, and sometimes there may be congenital anomalies also, or the baby may grow oversized, and because of that we may have to go for a cesarean section, and chances of high blood pressure, we call it as PIH, these are also increased. So it is very important that diabetes should be under control during pregnancy, and for this medical nutritional therapy by the dietitian plays a major role, and along with that now we are giving medications also to control diabetes.
So ma'am, apart from diabetes, what are the other medical disorders does nutrition have a direct impact on the woman's health as well as the baby's health?
Now iron is very very important because యాజ్ వి ఇప్పుడు మేము అనుకున్నాం కదా, ప్రెగ్నెన్సీలో ప్లాసెంటా తయారవుతుంది, తర్వాత అమ్నియోటిక్ ఫ్లూయిడ్, యూట్రస్ పెద్దగా అవుతుంది అండ్ బేబీ పెద్దగా అవుతుంది. సో దీనివల్ల ఇవన్నిటికీ మరి ఐరన్ అవసరం కదా, మదర్ దగ్గర అంత అవసరం ఉండదు ఎంతైతే అవసరమో. సో అందుకని ఇప్పుడు ఐరన్ అవసరం ఏంటంటే ఆల్మోస్ట్ 600 milligrams అవసరం పడుతుంది అనమాట ఈ ప్రెగ్నెన్సీలో. మరి దీన్ని మనము ఎక్కువ చేసుకోవాలి అని అంటే మెడిసిన్స్ ఇచ్చినా కానీ ఆహారం అయితే చాలా ఇంపార్టెంట్.
So Sunitha ma'am, what are the foods available in our kitchen which are rich in iron?
ఈ ఐరన్ రిచ్ ఫుడ్స్ టు ప్రివెంట్ న్యూట్రిషనల్ అనీమియా అన్నప్పుడు ఐరన్ అనేది 2 రకాలుగా ఉంటుందండి, హీమ్ ఐరన్ అండ్ నాన్ హీమ్ ఐరన్. హీమ్ ఐరన్ అనేది యానిమల్ ఫుడ్స్లో ఎక్కువగా ఉంటుంది అన్నమాట. ఫర్ ఎగ్జాంపుల్ ఈ ఆర్గన్ మీట్ లైక్ లివర్లో కానీ, చికెన్ కానీ, ఫిష్ కానీ, మీట్ కానీ. తర్వాత నాన్ హీమ్ ఐరన్ అనేది బేసికలీ ఫ్రమ్ ద ప్లాంట్ సోర్సెస్ అన్నమాట, ఆకుకూరలు, తర్వాత డ్రైడ్ ఫ్రూట్స్, జాగరీ ఇలాంటివి అన్నమాట. సో ఈ హీమ్ ఐరన్ అనేది బయో అవైలబిలిటీ అనేది బాగా ఉంటుంది, వెరాజ్ ఫ్రమ్ ప్లాంట్ సోర్సెస్ ఈ నాన్ హీమ్ ఐరన్ ఏదైతే ఉందో అది బయో అవైలబిలిటీ టు ద బాడీ అనేది కొద్దిగా తక్కువగా ఉంటుందన్నమాట. సో వాట్ బెస్ట్ వీ కెన్ డూ ఇఫ్ సమ్వన్ ఈజ్ ఎ వెజిటేరియన్, వాళ్ళు అనిమల్ ఫుడ్స్ తీసుకున్నప్పుడు మనం ఏం చెప్తామంటే ఆఫ్టర్ యువర్ మేజర్ మీల్, లంచ్ తర్వాత కానీ డిన్నర్ తర్వాత కానీ హ్యావ్ అ విటమిన్ సి రిచ్ ఫ్రూట్, ఆరెంజ్ కానీ లేకపోతే జామకాయలు కానీ లేకపోతే నిమ్మకాయ రసం కానీ, ట్రై టు హ్యావ్ అ విటమిన్ సి రిచ్ ఫుడ్ సో దట్ ఇట్ విల్ ఎన్హాన్స్ ఐరన్ అబ్జార్ప్షన్. అండ్ టిపికల్ హైదరాబాదీ హ్యాబిట్ ఏంటంటే హ్యావింగ్ ఎ చాయ్ ఆర్ ఆఫ్టర్ యువర్ బ్రేక్ఫాస్ట్. ఇలాంటి హ్యాబిట్స్ షుడ్ బి డిస్కంటిన్యూడ్ బికాస్ tannins and oxalates in tea will inhibit with iron absorption. So rather than taking tea or coffee, if you have a habit, try to postpone and keep at least 1 hour gap after a meal. And it is best to have a vitamin C rich fruit so that it can enhance iron absorption. ఇంకొకటి ఏంటంటే ఈ iron absorption and calcium supplements కూడాను 2 ఒకేసారి తీసుకోవద్దని కూడా చెప్తూ ఉంటారు.
అండ్ యాక్చువల్లీ చాలామంది ఏంటంటే పల్లీలు బెల్లం తింటే వేడి అండ్ నువ్వులు తింటే వేడి, ప్రెగ్నెన్సీలో తినకూడదు, ఇవన్నీ కొన్ని అపోహలు ఉన్నాయి. బట్ ఇప్పుడు సునీత గారు చెప్పినట్టు బెల్లంలో చాలా ఐరన్ కంటెంట్ ఉంటుంది, అండ్ ఖర్జూర పళ్ళు కూడా తినొద్దంటారు, పప్పాయ పండు తినొద్దంటారు. సో ఇవన్నిటితోటి ఏమి అబార్షన్స్ అవన్నీ కావు, దే ఆర్ క్వైట్ హెల్దీ అండ్ ఇట్ క్యాన్ బి టేకన్ డ్యూరింగ్ ప్రెగ్నెన్సీ.
Do post your queries on the topic pregnancy and nutrition and we'll get them answered by our doctors here. So moving to the next question, we've got Mrs. Sharanya from Secunderabad. She wants to know what are the foods to avoid during pregnancy and can raw food like salad or sushi be taken?
Yes, salads are healthy provided they are prepared at home, because when we are at home we wash the vegetable, grate it and cut it and prepare it in a hygienic manner. But when you are on outside in a restaurant, it's best to avoid certain foods. Sushi can be, when we talk about foodborne illness, it's best to prevent foodborne illness during pregnancy kada. So try to have more of home food, only hygienic outlets if you're going outside, take extra care, and drink pasteurized milk gani, well cooked meat. When it comes to meat, it has to be cooked to appropriate temperature so that you can prevent all these foodborne infections.
So ma'am, similarly, is coffee safe during pregnancy, and if so, how much coffee can one consume in a day?
Caffeine inhibits the absorption of iron, so it is better to cut down. Probably 3 cups in a day is okay, not beyond that, and it is better like you take without milk, without sugar if you can. That is adequate and better.
So moving to the next question from a social media network, we've got Ms. Sanjana from Bangalore. She says that she is in the first trimester of pregnancy with severe nausea and vomiting. So what foods to consume and what foods to avoid?
Nausea and vomiting are very common during pregnancy for some women, morning sickness. If they come to us with this kind of issues, simple tips that we tell them is have small frequent meals, stay well hydrated. Drinking adequate amount of water is important, Andy, otherwise they become dehydrated. Another thing is the best thing that you can have when you have this nausea feeling is dry biscuits or dry food that can suppress the nausea feeling. Also sniff lime, you can have ginger tea, and always having meals in a well ventilated room where there is inflow of fresh air also decreases nausea, and avoid those kitchen smells which can trigger nausea.
So ma'am, apart from nausea and vomiting, even constipation is one of the most common problem faced during pregnancy. So what diet would you recommend for this?
So for whatever reason there is constipation, so we tell them about high fiber diet, at least 25 grams of fiber per 1000 kilocalories. And how do you get this dietary fiber or roughage from? Various fruits, especially those with edible skin, lot of vegetables in your diet. That's why we say 5 a day, minimum 2 fruits and 3 servings of vegetables. And vegetables could be in form of raw salads, which are a good source of fiber again. At least have 1 meal which comes from unprocessed cereal. So out of 3 meals, 1 could be from unprocessed cereal, which is a good source of fiber. And also drinking adequate amount of water is equally important.
I will add here one more thing, because the most important is the calcium. Calcium is really very important during pregnancy, and women have to think about this. And most of the women say that I can't drink milk, I am not used to yogurt or curds. So ఒకవేళ కాల్షియం తీసుకోకపోతే మీ బోన్స్ నుంచి కాల్షియం అంతా వెళ్ళిపోతుంటుంది. సో దానివల్ల మీ బోన్స్ వీక్ అవుతూ ఉంటాయి. సో అందు గురించి కాల్షియం తీసుకోవాలి. I think at the end, I think women should really enjoy the pregnancy and should not go into all these issues. I'm not able to tolerate, I'm suffering. And I think one more advice I would like to give is never start Googling about your issues. Probably you can register yourself on a pregnancy site to see the update every week, how your baby is growing, what are the changes your body will have. That is a better suggestion rather than Googling your issues, which will give thousands of reasons and you cannot place where you are, and this will lead to apprehension and frustration. Instead of enjoying, you will be always get worried about why I'm having this. I think every woman should enjoy their pregnancy. Thank you.
So this brings us to the end of the session. Hope all your queries on the topic nutrition and pregnancy were answered by expert doctors here. Thank you for your active participation, and we look forward for joining us onto the next week as well. Thank you and stay safe.